Into the Fold is a podcast on mental health issues, produced by the Hogg Foundation for Mental Health. I'm your host, Ike Evans.
I am extremely thankful to be vaccinated. I'm high risk should I acquire COVID. My lungs have a harder time fighting off infections, respiratory infections, as does my husband, who has the same condition. So I had a lot of sleepless nights worried about what would happen if one or both of us got sick and what would happen. We have 3 kids. And so I'm a fairly high anxiety person anyways, somewhat related to my disability. So my condition is I can break bones easily, and sometimes something could cause a fracture, sometimes it might not. So it's kind of the recipe for creating anxiety. And so I'm already a pretty anxious person, and adding COVID on top of that really was difficult for a number of months. I think the next step that we're waiting for our family is the children to be able to be vaccinated. My oldest is 14 and he is fully vaccinated, but my 2 youngest daughters are not. So, we are still largely masking in public unless we're outdoors and spaced out pretty well. And so some things look the same, other things, have gotten better. I think that it's interesting because the disability community has demonstrated some strength and, of course, resilience throughout this, but it hasn't mitigated the impacts of, I'm thinking of the direct support provider crisis that was already in place, that was exacerbated. I've had friends that in the midst of the pandemic, their caregivers stopped showing up. And of course, you can understand it from multiple perspectives, right? You can understand it from the need to stay safe for both the individual with the disability and the caregiver who may be going into multiple homes. But there's no safety net for our caregiver programs in our country in terms of how are those persons' basic activities of daily living, their basic needs, bathing, eating, getting in and out of bed, met when your caregiver just stops showing up. I think one of the harder to document, but still very impactful, was also this dialogue that society started having and in many ways didn't stop having, that, only the sick or the old would die. And so, first of all, we now know that that's not true, very inaccurate, but just the impact of hearing so many people be fine with that or see that as a reasonable expenditure during this pandemic, when we also knew that there were things we could do to prevent loss of life. So I think that for many of us, including myself, is a deep wound that will take, I'm not sure what amount of time or what to heal. It's a very deep sense of distrust in that it's, I've heard some people describe it as saying the quiet part out loud. So it wasn't a surprise that the disabled life was so devalued, but it was pretty hurtful, especially to see people maybe through social media that you knew, sometimes loved ones or friends, family members, that would make comments like, we got to get on with it. Unfortunately, it might make some people really sick, but they were probably sick already. And so to see that callousness in our society has definitely been hurtful. My perspective has definitely changed, since pre-COVID, in terms of what priorities I have. And I'm definitely committed to taking some of these lessons learned and not just losing them. I like a lot of advocates, don't have this urgency to go back to normal, because normal in many ways wasn't great for our disability community. And I think we've learned a lot of lessons that I don't want to just forego applying because we're all interested in getting back to things.